Climate change. It's no longer just an environmental issue. It's a public health emergency. Rising temperatures, more frequent natural disasters, and shifting ecosystems are threatening the health of millions worldwide. And healthcare systems, the very institutions meant to protect us, are on the front lines of this crisis. Climate change is often discussed in terms of rising sea levels, carbon emissions, and melting glaciers. But its ripple effects are being felt far beyond the environment. The World Health Organization calls climate change the greatest health challenge of the 21st century. As temperatures rise, so do the threats to human health. From heat-related illnesses to waterborne diseases, the impacts are already here, and they are accelerating. What we once considered natural disasters are now becoming the new norm. Heat waves, hurricanes, wildfires. And each time, it is the healthcare system that's left to pick up the pieces. Take heat waves, for example. In 2023 alone, extreme heat killed tens of thousands of people in Europe, North America, and Asia. And it's not just the heat itself that's dangerous, it's how our bodies react to it. Our bodies aren't designed to handle prolonged exposure to high temperatures. Heat stroke, dehydration, and heart attacks spike during heat waves. Vulnerable populations like the elderly, infants, and those with pre-existing conditions are most at risk. The toll on healthcare systems? Catastrophic. Emergency rooms become overwhelmed. Hospitals not built to withstand these extreme conditions often struggle to maintain adequate cooling, making it harder to treat patients. This is just one way that climate change is pushing healthcare systems to the brink. Climate change is also making infectious diseases more widespread. As temperatures rise, the habitats of disease-carrying insects like mosquitoes and ticks expand. Diseases like malaria, dengue fever, Lyme disease, and Zika are now spreading into areas that were once too cold to sustain these vectors. With higher temperatures and increased humidity, mosquitoes breed more frequently and viruses replicate faster. In 2022, the CDC reported an uptick in cases of West Nile virus in the United States, largely due to changing climate conditions. In regions like Sub-Saharan Africa, where malaria was already a problem, the situation is becoming even more dire. But it's not just infectious diseases. Air pollution, driven in part by fossil fuel consumption and deforestation, is worsening respiratory conditions around the world. Each year, air pollution kills an estimated 7 million people globally. Fine particulate matter known as PM2.5 and other pollutants from vehicles, factories, and wildfires penetrate deep into our lungs, causing asthma, bronchitis, and other chronic respiratory conditions. Children are particularly vulnerable. Studies show that polluted air can stunt lung development and lead to lifelong health issues. Healthcare systems are being forced to deal with this surge in respiratory illnesses, with billions in medical costs and untold human suffering. And as wildfires become more frequent due to climate change, this situation is only getting worse. Climate change isn't just making people sick, it's forcing millions to flee their homes. In 2022, more than 20 million people were displaced due to weather-related events such as floods, hurricanes, and droughts. Many of these climate refugees end up in overcrowded camps or informal settlements where access to healthcare, sanitation, and clean water is limited. Waterborne diseases like cholera and dysentery thrive in these conditions, exacerbating public health crises. And as droughts intensify, water scarcity is emerging as a major health threat. By 2050, it's estimated that over half of the global population could be living in areas facing water shortages. Without clean water, hygiene deteriorates and infections spread rapidly. Then there's the mental health impact. Surviving a climate disaster, losing your home, your livelihood. These experiences leave deep psychological scars. Studies show that climate-related trauma is leading to higher rates of anxiety, depression, and PTSD. And yet mental health services are often the first to be cut when healthcare systems are overwhelmed. It's not just that climate change is affecting healthcare. Ironically, healthcare is also contributing to the crisis. The healthcare sector is responsible for nearly 5% of global carbon emissions. From energy-hungry hospitals to single-use medical plastics, healthcare's carbon footprint is significant. In the US, the healthcare sector's emissions are comparable to that of the aviation industry. But this isn't just an environmental problem, it's a health problem. Air pollution caused by healthcare-related emissions is linked to thousands of premature deaths every year. As healthcare systems work to treat the effects of climate change, they are also perpetuating the very problem they're trying to solve. So what can be done? Around the world, healthcare institutions are waking up to the dual challenge of treating climate-related illnesses while reducing their own environmental impact. Many hospitals are turning to renewable energy, improving energy efficiency and reducing waste by minimizing the use of single-use plastics. Initiatives like Practice Green Health are leading the charge in making healthcare more sustainable. Healthcare workers are also becoming vocal advocates for climate action. Recognizing that climate change is a public health emergency, they're pushing governments to adopt stronger environmental policies, knowing that every degree of warming avoided could save lives. Addressing climate change is essential for the future of healthcare. By transforming the way we operate, we can not only save lives in the present, but safeguard the health of future generations. The intersection of climate change and healthcare is undeniable, but the solutions are within our reach. It's up to us, healthcare professionals, policymakers, and citizens, to act.